welcome back to my show. I'm Dr. Locke from Acupuncture is My Life. Now in this episode, I'd like to discuss the effects of the coronavirus on the kidneys. Now if you have not seen the episode on the basic functions of the kidney in Chinese medicine, I'd suggest you pause and watch that episode first so that you can have a basic understanding of the functions of the kidney from a Chinese medicine perspective. Now, for those that have watched that episode, then you should remember that the functions of the kidneys in Chinese medicine are: they store the essence and govern birth, growth, and reproduction and development. They produce marrow, they fill up the brain, and control the bones. The kidneys govern water, they control the reception of qi, and open into the ears. Now the kidneys also control the two lower orifices and house the willpower and control the gate of life. Now let's begin with discussing the coronavirus and how it affects the kidneys. Now keep in mind, this virus can affect people of all ages, including children, so that this disease is age specific, you're wrong. I've actually heard teenagers call the virus the boomer remover. Not at all. Basically, the majority of infections tend to be mild, generally presenting with flu-like symptoms, but the more common clinical presentations tend to be fever, cough, fatigue with accompanying leukopenia, and lymphopenia. Now, the kidney's involvement in this infection can show a small incidence of acute kidney injury, but there have been recent reports that have shown a higher frequency of renal abnormalities such as massive albuminuria or proteinuria as well. Now, there are cases of elevated blood urea nitrogen in most patients. Upwards of 2/3 who have passed away from this virus. It is assumed that mechanisms pertaining to kidney injury include sepsis, which tends to lead to a cytokine storm syndrome. Now, newborns, the elderly, and patients with pre-existing conditions such as diabetes, high blood pressure, and cardiovascular disease are likely to express a more severe response to this virus requiring care from intensive care unit. Now, kidney involvement tends to be frequent in patients affected by coronavirus. Proteinuria often occurs in the beginning or during the infection, and there can be traces of blood in the urine as well. So keep in mind the coronavirus also attacks the kidneys, not just the lungs. Now let's look at things through the eyes of an acupuncturist. Now if you as a patient were to come to me after having been infected with the coronavirus, during my intake, I would ask questions with a focus toward disharmony patterns relative to balanced kidney function in Chinese medicine. When examining their tongue, I would check to see if it's red and cracked with a red tip and without coating, as well as paying close attention to the chirp position on the pulse to see if there's any signs of deficiency. My focus would be to look for a floating, empty, and rapid pulse. My concern would be to see if I need to cool down the blood and to clear excessive pro-inflammatory cytokines from the blood to address the cytokine storm caused by this infection. Now, one pattern I would look for during intake is to see if the patient is showing signs of kidney insufficiency with empty heat blazing. Now, relative symptoms would be malaflush, mental restlessness, insomnia with night sweats, and a low-grade fever, 5-palm heat with afternoon fever, and I would also inquire if the patient is experiencing scanty dark urine. Is the patient experiencing a dry throat? And if there's thirst with a desire to drink in small sips, I would look to remove kidney heat and reduce kidney inflammation. Another potential pattern I would look for is if the kidneys are failing to receive qi. Now, of course, one of the primary symptoms of this viral infection is shortness of breath. I would check for that, as well as if there's signs of rapid and weak breathing. Is the patient showing signs of difficulty inhaling with a chronic cough? I'd want to know if the patient is experiencing spontaneous sweats and cold limbs after sweating, and are there any bouts of dizziness throughout the day. I would check their tongue to see if it's pale, and also see if they have a deep, weak, tight pulse. These are signs and symptoms that a patient would experience if the kidneys are failing to receive qi. Now, relative to this pattern, does the patient have some sort of long-standing chronic disease which inevitably affects the kidneys? If there exists some sort of long-standing chronic disease, I would add acupuncture points such as DU12 and bladder 13, because most times with chronic diseases, the lungs are involved. Now, the main pattern in which I would check for in a patient affected by coronavirus is kidney yin deficiency. The main symptoms I would expect to see are dizziness, night sweating, dry mouth and throat at night, dark scanty urine, tiredness, and lassitude. I would expect to see a normal tongue but without coating, and a floating and empty pulse. In this case, I would look to nurture kidney yin and help improve microcirculation to improve overall blood circulation. This pattern support can be tied to something I previously stated, which is that in coronavirus, it can also affect the brain. You see, deficient kidney yin would fail to produce sufficient marrow to fill the brain, whereby you would experience symptoms of dizziness, tinnitus, vertigo, and poor memory. Now, whenever you're able to see an acupuncturist, I would recommend you do so along with seeing your primary care physician and possibly a nephrologist. Other than that, remember to wash your hands as often as possible and practice social distancing. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?